Assalamualaikum warahmatullahi taala wabarakatuh, and a very good morning to all of our student. I hope you are aware about this career talk in pharmacy. So today I want to share with you my experience in career as a pharmacist. Actually, this slide was prepared by my friend who is also our ex-MRSM PC student, same batch with me, Puan Noor Haslina Othman. And I am Zalina Zahari, will present this slide on behalf of her. So, as a pharmacist, this is the career choices that we have. There is also another career in pharmacy, but what I show here are the most commonly or most commonly career involved in pharmacy. So here we have 1, 2, 3, 4, 5, 6, 7. 7 careers. Okay, for example, mostly pharmacy will be in the hospital or health clinic. So we call it hospital pharmacist or health clinic pharmacist. Some will be in the regulatory as a regulatory pharmacist. This one, when you we will go in detail later, but it's basically pharmacists who regulate or enforce the law of the pharmacy. For example, they want all the pharmacies, for example, in the community pharmacy, this community pharmacy follow the regulation, or they also have other um, uh, tasks to do. That I give just as example. So, for example, another example, when we have somebody who sell drug without license. The regulatory pharmacy, they can come and catch you as like a policeman here. So now we go to the research and development. So pharmacy also involved in research and development. For example, someone who work in the company, drug company, they can also involve in research and development of the product. So here is the pharma industry. You know what is the pharma industry? I give you an example, like industry or manufacturing company who manufacture medication. So they need pharmacists in their pharmacy or in their facilities. So community pharmacy, I think everyone know what is a community pharmacy. When you go to the retail pharmacy, we also call it retail pharmacy. When you in outside there, there's near your place, there's pharmacy. So actually we call it as community pharmacy. So you may own your own pharmacy and be a pharmacy in charge there. Here is the administration. So we have administration job. For example, in the KKM. You know what is KKM? Ministry of Health, Kementerian Kesihatan Malaysia. I just give an example. So in any of the organization, for example, in the hospital, USM, Hospital University Malaysia, there is pharmacy who involved in administration. So we also have academic section. For example, before this, I work as a hospital pharmacist at Hospital USM Kubang Kerian, Kelantan. Now, for 70 years, now I work as academician, as a lecturer in pharmacy. Okay, now I will share with you the activities mostly at the hospital pharmacy, because my friend Noor Haslina, she have wide experience in hospital HRPZ Kota Bharu. Hospital Raja Perempuan Zainab II, Kota Bharu. So, firstly, we look at the activity at unit outpatient, pharmacy pesakit luar. So, what we did what we always do, we do the counseling. So, counseling, we have individual counseling session. So this is you as a pharmacist, this is the patient here. Okay, so look at this picture. Actually, this is a very interesting session. I also have experience with this activity. This is very interesting for me, because you can teach your patient, you counsel your patient how to use the medication correctly. Okay, now we look at the group counseling. So, for example, here we have a lot of facilities now. So we have TV here. We can play our CD, recorded CD, recorded video here, and then we show to the patient. And then during the session, the patient here can ask us what they don't understand about the medicine. So usually we will do, for example, this group of patient with diabetes. Maybe here in other day we do counseling for patient with hypertension. So we call it as a group counseling. Now this is much more like advanced and a new service that we have in our hospital setting in Malaysia. For example, we have here the medication therapy adherent clinic. This is very specialized. For example, this patient take medication with need, for example, warfarin. Warfarin is used as anticoagulant. So need special precaution and special monitoring. So we have pharmacists in charge for the medication therapy adherent clinic, or we call it as MTech. So here is also interesting, because you are the specialist pharmacy in your clinic, in your area. So this is much interesting. Here is general. You have to have general knowledge. Here you have more specialized knowledge. And then another one is pain MTM, or medication therapy management. Pain medication therapy management. You know what is pain? Pain is most of the patient have pain. Pain is sakit lah, kesakitan. So who always have pain? Pain can be divided into minor, moderate, and severe. Mostly, patient with cancer, they have severe pain. So they need the strong medication to take. And then pain, we might combine medication to treat patient pain. So if you have friends, if you have a relative who has cancer, they will have very severe pain, and we have to control their pain. Okay, because pain can have variable. Some patients have very mild pain. Some patients have severe pain. So when we manage patient with pain, we have to believe what patient said. For example, she said he in severe pain. So we have to believe that he is experiencing severe pain, and we have to manage with a very strong painkiller. Okay. Now we go to the inpatient pharmacist. So what inpatient pharmacists do? There's a lot of job. So I will explain one by one. Mostly we will supply the medication to the patient who are in ward. So we call it inpatient. Inpatient means patient in the ward. So for example here, we prepare the medication. We prepare the medication in the pharmacy, and then the staff nurse will come to the pharmacy and collect the medication to bring the medication to the ward. So this is usually we as a pharmacist, we have to screen the prescription. You know what is the prescription? Prescription is the written order from the doctor. What doctor order, we as a pharmacist has to screen. Why? Because we want to make sure all the medicine or drug that we supply to the patient is safe and effective. Means no medication error. We don't want patient to have wrong medication for the wrong indication. So we have to know the indication, we have to know the dose, we have to know the how the drug is given. Okay, so basically here to summarize, we supply the medication to the patient in the ward. So beside that, we have the activity like stock checking in the ward. So we have our schedule. And we go to the ward. We check the medication in the medication trolley. For example, here we have the emergency trolley. So emergency trolley is important because when there is emergency, we need to have the medication very fast. So we have specific trolley in the ward to trolley which contain all the important drug to be used as in the emergency cases. For example, we had when patient have cardiac arrest or problem, cardiac arrest lah, heart problem. So all in the emergency cases. So basically, we also do the counter checking medication. Before we supply the medication to the ward, here we have to do the counter checking because Why? Because we want to make sure all the medication given are correct. Means the correct drug to the correct patient. You can imagine what happen if you give wrong drug to the wrong patient. This is very, very dangerous. So this one we can, if there is error like that, we call it as medication error. So actually, there's as I mentioned, this are the other activities that have been done. For example, cardiac rehab program. So this all the patient with cardiac problem or heart problem. So we invite them to involve in cardiac rehab program. So many activity will be done so to assist patient to have a better quality of life. Okay, here what we do here, we go to the patient house and we ask patient to bring all their medication out, show to us, and we counsel them. We check their medication, we counsel them, and for what? Because we want them to adhere to the prescribed medication. Adhere means they follow what doctor order. So our important job is that to make sure the compliant. So compliant meaning the doctor asks you to take this medication, and then the patient take according to the order of the doctor. So we do home medication review to help patient understand about their medication, and when we go to their home, we can check how they keep their medication, how they store their medication. So if if the patient did not follow the instruction, then we can counsel the patient at their home. So another one is methadone replacement therapy. So here we usually at the psychiatric clinic we have one place, allocated place. So here we supply the methadone. So what is methadone? Methadone we use is a drug, opioid drug, in the same group as morphine. We use methadone to replace the drug dependent problem. For example, previously they taking morphine or heroin injection, so they become drug dependent patient. So this patient will come to the hospital or clinic under the methadone replacement therapy. So we call it MRT, or also methadone maintenance therapy. So this patient will come to the clinic, methadone replacement clinic, every day to take their methadone. Okay, now there's it's much specialized here. Like my friends here, Noor Haslina. This is Noor Haslina. She is a clinical pharmacist. She an expert in clinical. So she do the pharmaco therapy activity. So she has teams include doctor here and nurses, and she will go for ward round. So ward round here. Okay. So she also involved in MTech. Just now I already explained about the MTech. She do the counseling to the patient and also the home medication review. This is one of the example, home medication review. This one of the example, MTech here. And then the counseling. So usually when we involve in MTech, of course, we will do the counseling to the patient. So this is the pharmacy pengeluaran. We have the, for example, here we have the clinical non-sterile, which in this production pharmacy, we will prepare the medication such as cream, we do the lotion, we do the solution. Some hospital, they prepare their own paracetamol syrup. Okay. Now we have the cytotoxic drug reconstitution. What is the use of cytotoxic drug? We use cytotoxic drug for the treatment of cancer. So most of the drug we will give by intravenous infusion or injection. Intravenous is we give the medication through the blood vessel. So when we need a sterile drug, so we as a pharmacist here will prepare our cytotoxic drug in the specialized cabinet here. So the product we make sure is sterile. Same principle to the parenteral nutrition product, where we give the nutrition to the patient. A patient cannot take food. Maybe patient in the intensive care unit, so they cannot take food. So we give the nutrition to the patient by the blood vessel. So we have to prepare in the same environment here. We call clean room, and then we prepare based on the requirement of the patient, and we supply to the patient in the ward. So here we have the clinical non-sterile. Here cytotoxic drug and parenteral nutrition sterile preparation. So this slide summarize the production pharmacist job. So here is the drug information and pharmacokinetic. So what we do, we have to make sure the safety of medication. So medication safety, we want to prevent the medication error. Previously, I mentioned about the medication error. What is the meaning of medication error? We supply the medication, patient receive the wrong medication. There is a very many types of medication error. So I don't have to tell you in detail, because this will take very long hours to explain. But in summary, we want to prevent the medication error. That's why we have the medication safety activity. And then we have the therapeutic drug monitoring unit. Okay, so in summary, these are amongst the activities done for the drug information and pharmacokinetic unit. Now we have a look at pharmacy logistic and what pharmacy logistic do. For this, they they buy medicine or drug to be used in the hospital or in the setting, whether it's in the klinik kesihatan or hospital. So if you like to do to shopping, so you like to work at the logistic pharmacy. Okay, there's a lot of procedure you have to follow because we want to make sure the whole hospital have enough medication to be used, and we have to make sure also the medication not expired, because expired we cannot use for the patient anymore. Okay, so this is the enforcement pharmacy. As I mentioned before, one of the carrier in the pharmacy carrier. So we check. So here, look here, penguatkuasa pharmacy. We check the product by manufacturing industry. We do searching. Okay, here. Okay, so this is our main in Malaysia. We have National Pharmaceutical Regulatory Agency, NPRA. So this bahagian regulatory farmasi negara will enforce all the law, and we have to follow the law. Okay, so actually there's a lot other activity done by the NPRA. We call it NPRA. So before I end my lecture or the career sharing, this is the question that you should ask. If you answer yes to any of those questions, pharmacy would be the very good choice of profession for you. So how can I understand that I am the right person to be a pharmacist? You ask yourself, am I interested to help people? Because pharmacist, you cannot work alone. You work with people. So are you interested to help people? Am I be very good listener and critical thinker? As a pharmacist, you have to be a very good listener because you need to do a counseling session. So you listen to the patient and you think and give your suggestion. Do I have strong interest in maths and science subject? This is of course lah. Pharmacy is involve patient, so involve also calculation. For example, pharmacokinetic involve a lot of calculation. Clinical pharmacy involve science. So you have to understand why you need strong interest in math and science. Do I enjoy health-related profession, working directly with physicians, nurses, and other healthcare professionals? So as I mentioned in my presentation, we did not work alone. We work with other profession. We work with doctor, we work with nurses, and other healthcare professionals. So when we work with other healthcare professionals, we need a very good communication skill, and we know how to interact with other professionals. Do I wish to work in an exciting and dynamic environment where life are safe every day? Yes, of course, because we every day involved with patient, so sometimes we have emergency, doctor need medication urgently at 2 in the morning. So we have to provide the medication so we can save patients' life. Am I seeking endless opportunity for career growth? So as a pharmacist, you can create your endless opportunity for your career. It's all is up to you. So if you answer yes to any of those questions, that's why I said pharmacy would be the very good choice of profession for you. Okay, with that, thank you.